Hello, hello, and welcome to today's podcast. Today, we are going to be talking about sleep.
Yes, sleep
Happens
or
at
the lack of it.
happens at the end of the day, but really determines how our next day is going to play out.
Yeah, sets us up for health too. There's just so many things that happen during sleep that need to happen during sleep. And so hopefully we can shed a little light on maybe some of the causes and the things that you can do to maybe help with that.
So, why is sleep so important? What actually happens while you're asleep?
Yeah, with sleep, I mean, you can really look at it as just it's a way for our body to recover. In a nutshell, that's really kind of what it is. Everything is recovering. And whether you're recovering from a daily stress or a physical stress, it doesn't matter. The brain's way to clear and clean itself up, to reboot the system, is for us to get good sleep. And there's so many different stages of sleep that we'll go through a little bit, but it's just the missing piece. And if I really have to state one biohack, and I hear this from a lot of people too. And I agree, but if there's one biohack you can do, it's getting sleep. Sleep will help improve your longevity, period. And it's better than any supplement that you're ever going to take. So it's pretty incredible, the importance of it.
And I think that sleep is also one of those things that we often put on the back burner. We don't think of it as such a great tool for our recovery. We say, oh, I'll catch up on the weekend, or
right.
I really only need 5 hours of sleep, which I have never said in my whole life ever. I need a lot of sleep.
I used to say that, and now I've changed my tune on it, knowing the importance of it. But yes, I used to, in an earlier time in my life, would not need or require a lot of sleep, I thought. But I'm sure it affected my mental and physical outcomes, in general. So certainly it's the importance of it cannot be overstated.
And I worked overnight for several years,
Right.
And that shift work overnight, I knew that's really when I think I had always been a night owl, what I thought as a night owl. And then I went and started working nights, 12-hour shifts overnight, and then really figured out I was having a hard time getting home without falling asleep in the morning. And then, of course, I was also going home to two kids. One was in kindergarten and one was at home with me watching TV while I caught a few Z's.
Yeah. And, myself back in the residency, and not so much, a little bit in practice, but, having a lack of sleep in the middle of the night or trying to work through the night, in some situations, you would definitely notice a difference the next day with just cognition and be able to reproduce, activities and remembering things. And so it's quite something.
Yeah. So at night, you've got tissue repair, growth hormone is working, your immune system is calibrating, your brain is cleaning up memories and emotional stuff. Insulin sensitivity is worked out during the night.
Just general metabolic control. It's improved and optimized with adequate sleep. Your body has to repair and recalibrate. And by doing that, then that just boosts our immune system. But when we get older, we're looking at midlife causes problems by amplifying these difficulties with our sleep. So now we've got an increase in stress load, got hormone imbalances with, perimenopause, andropause, and then now you throw in alcohol sensitivities and recoveries, that just changes our ability to get good night's sleep. So.
Yeah. So with midlife comes, just like what you said, stress and cortisol changes, hormone shifts, overtraining potentially, under recovery, not to mention, this isn't necessarily just in midlife, but in our life right now, blue light is really detrimental to our sleep. And the other piece that we kind of alluded to is life in general. So If you have a new puppy, you're probably not getting the sleep that you need. If you have a new baby, you're probably not having the sleep you need. If you have teenagers who are driving and coming home late at night, you're probably not sleeping. If you're caring for aging parents, you're probably not sleeping. So there's a lot of things that happen that are outside of our control on our sleep, which make it so important to really get keyed in on how to make the sleep that you do get to have the best quality and as much as you can get.
Right. And then, of course, with cortisol levels, they increase and spike in the early morning hours. And so that's what basically will wake us up. Cortisol surges wake us up. Well, if you're always under stress with chronic stress, like a lot of people are, well, your cortisol dysregulation can affect that sleeping pattern. So that's the reason why, in the middle of the night, now my spike is at 2 or 3 in the morning, or I've got a lot on my mind. I've got a lot of projects I have to do. And so your stress level is higher. So your cortisol level stays higher. You don't have that cyclical rise and fall typically. So, and then hormonal shifts just exaggerate that problem too for folks. But yeah, pets and kids can really be a contributor to sleeping patterns for individuals.
The other thing that is a lot more prevalent these days is sleep apnea, and that absolutely gets in the way of a lot of people's sleep.
Mm-hmm. Yeah, sleep apnea, basically where an individual goes to sleep and tries to go into the deeper layers and deeper zones of sleep, and they just can't because they obstruct. And so what happens when you go to sleep, you start to snore, then you obstruct, and then that wakes you up. And you may do this subconsciously. So you're constantly undulating between the upper layers of sleep. You never get into the deeper layers of sleep where the biggest part of repair and the immune system balance and hormone regulation actually help and occur. So the areas typically where people will have these problems with obstruction can be, in 3 areas, essentially in their nose, their throat, in the back of the throat where the tonsils and the palate are, or in the base of the tongue and the neck area. And so if we're overweight, then that is something that can obstruct folks and create more problems. So, but it's certainly something where it's significantly underestimated, underdiagnosed, I might add too, with sleep apnea. So the prevalence can be quite significant these days, and we're looking at anywhere from 10 to about 40% range globally of individuals that do have obstructive sleep apnea. And the older we get, the more likely you are to kind of have that problem too. So
some of the signs and things that you would have somebody look out, obviously, if you are sleeping, you don't always see these things, but if your partner says that you snore, that would be something to think about. And if they say that you snore, asking them, do you stop breathing when you're sleeping? That would be another thing that a lot of times people don't know that or haven't asked that.
And then, of course, you've got the partner that can't sleep either now because they're snoring. So it's kind of a two-sided coin here with that.
But sleep apnea can cause other things like daytime sleepiness. That's kind of an obvious one. Irritability, also a little bit obvious, but high blood pressure can be a cause of sleep apnea, dry mouth, morning headache.
Yeah, exactly.
Walking or waking to have to go to the bathroom a lot. That could be part of that. And then not feeling rested when you wake.
So what's a good average amount of sleep a person needs? 7 to 8 hours is pretty key. Trying to get that good 7-8 hours sleep. That can also affect, HRV, heart rate variability. So now we have that's kind of the recovery report card. So HRV, heart rate variability, it's kind of a good indicator of our stress load, our balance of our autonomic system, whether we have an under or stimulated autonomic nervous system. Parasympathetic wise, that's more of our rest and digest. People that have that ability to rest also have the ability to recover better, and that will increase heart rate variability. So we'll see folks with insomnia problems that will have too much stress, if you will, in their life, which the sympathetic fight or flight mode is more exaggerated. And then those individuals that have the difficulties with the sleep patterns, then you'll see insomnia more in those folks.
And heart rate variability is often monitored overnight. That's really the best time to monitor heart rate variability because things are a little more stable. If you are wearing a wearable device that tracks your heart rate variability throughout the day, it's going to look different because you've got all kinds of activity that's going on during the day. You're doing workouts and then you're recovering and then you're, working and you've got some stress and all the things. So your heart rate variability could look a lot different if you're recording it all day long or just during the day, as opposed to watching what it is overnight. That's really the best.
There's a lot of
to look at.
There's a lot of wearable devices that can give you heart rate variability, but and there's going to be a lot of variability in that, of course. But the idea is to kind of watch trends and look and see what's going on. I used to be, here, now I'm up here, and I'm feeling much better, but now my heart rate variability is dropping. And heart rate variability is just the time between beats. That's how you can look at that. When that gets shorter, that's a little more of a stressful situation.
Yes. And so we have a whole nother episode about heart rate variability and all of those things to look at. But essentially for the purpose of just sleep in general, if you're monitoring your heart rate variability, the good thing is to know where you're at. What is your baseline? And then you can see where you're trending. So if you notice that you're trending lower, well, that may be an indication that you need a little more recovery time.
Yeah. I mean, things that affect it also are alcohol. Of course, any illnesses will affect it. That's a stressor for our system. Of course, overtraining and just poor sleep habits in general will affect it.
Sure.
So what kind of options do we have for sleep studies? There's a couple of types. One is what we call a home sleep study test. It used to be that sleep studies had to be done in a hospital or a clinic outpatient setting. And now there's a lot more detail that can be extracted from that data to predict what an individual's, sleep apnea rate is. It's listed as basically an AHI, apnea hypopnea index. And individuals, when they start having obstruction, or periods of obstruction that last more than 10 seconds, then that's apnea. And so when it starts to become more significant, then that can lead to more complicated metabolic and heart problems and blood pressure problems for folks. But home sleep studies now are very comparable and very easy to do. It's a lot easier to sleep in your own home with fewer wires. They're a little bit more comfortable than it is to try to go to sleep and have somebody watching you as you're sleeping in a hospital or clinic lab.
Yeah. And you can do that through, your regular doctor can order an in-home sleep study. There's also some self-pay options out there that are really reasonable. There's an easy kind of one-night sleep study that you can do. It's 1 to 3 nights, I think, with Sleep Doctor. There's another company called Empower Sleep, and that is a 30-day sleep study. It's a pretty neat deal. You wear the device for 30 days, but you wear it for the first 7 days, and then you talk with a sleep coach, or could be a sleep doctor, depending on who you have that day. Have a meeting and then talk about interventions that you can introduce as you continue through your 30-day total. So that's kind of a neat thing. It is, I think that test is $500, and there are certain parts of that could be billed to insurance. So something to look into if you're really interested in digging into
and then
sleep.
the home sleep studies, self-pay on those is under $200. It varies between $150 to $175. So at least it's affordable. But, oxygen saturation is a big component of that too. So, your brain and your heart lack oxygen. And that's something that when it dips, then it also notifies it's recorded. And then there's also just restless leg syndrome, restless sleeping. Sometimes that will be picked up. And that also is a condition where people just don't get good rest because they're constantly moving and twitching. So it's affects it.
So treatments for sleep apnea can range. Avoiding alcohol, especially in the evening, can definitely affect sleep apnea. Weight loss, which is one of the reasons why GLP-1s are now like a diagnosis code of sleep apnea, can get you approval for a GLP-1 to be approved through insurance. There are oral appliances that you can wear to,
to bring that tongue out of the back of the airway. The tongue attaches to the front part of our jaw. And when we go to sleep, our tongue relaxes and that falls back into our airway. So if we can get an appliance that pulls our jaw forward, that will pull your tongue forward to open the airway. So there are a lot of different types of appliances out there. If you have interest in questions about it, you can reach out to us and we can give you our opinions about it.
And then CPAP and AutoPAP are options if your AHI is high enough to indicate those. That is another option.
Insurance covered appliance. So, yeah.
And that treating sleep apnea can be a real game changer, especially, depending on how bad your apnea is, it can really make a difference in your overall health and well-being.
Sometimes people that have, just as a general rule of thumb, but people that have poor sleep habits, when they don't get into the deep layers of sleep, they don't dream. And so some folks, you'll ask them, do you dream? No, I don't dream. I never dream, but maybe I wake up in the night thinking that I'm suffocating, and I'll wake up gasping for breath. So sometimes those folks will state those types of histories for us.
So now that we've covered sleep apnea and kind of those things, let's talk about just general insomnia, where you just can't sleep.
Well, of course, we're not going to get into the medication forms of promoting sleep to an extent, but one thing I think that is kind of the gold standard that people kind of don't think about so much is what's called CBT-I. So that's cognitive behavioral therapy of insomnia. And the benefits of that are they far outreach actually sleeping aid medications. That some of the studies suggest that done properly and the right technique can give you an 80% success rate, an improvement in sleep quality for people. So that's pretty substantial.
So what are some pieces of, we're definitely not experts in this realm, but some of the things that are part of cognitive behavioral therapy: sleep schedule, consistent sleep and wake times.
Right. Yeah. Going to bed at, the same time, even on the weekends, going to bed at the same time and trying to get up at the same time. Letting your brain know that it's time to sleep or it's not time to sleep. So that's certainly something that done consistently will help improve that. We want to reduce our stimulus for bedtime. So that means no screening, trying to reduce the scroll and the swipe. So that's something to remember. Also, it's sleep restriction can sometimes be counterintuitive, but effective. And what do we mean by that? Naps. The cognitive behavioral therapy, there's a lot of opinions, but I feel like some of the individuals in the programs that do a good job don't necessarily support a nap. Now, you can get a nap if you just can't make it through the day, but just know that what you're doing is you're stealing from your next day. So, it's one of those things they'll tell you to try to just power through and go to bed earlier. It will only mess up that day. But if you nap that day and thinking that you just can't make it, then you're going to have another day that's going to give you a little problem catching back up again.
And this is where I would interject that we each need to use our own, intuition about how our body is working and feeling. And every person is different. And if you find that taking a nap during the day, you can take a 20-minute nap and feel really rested and then still go to sleep at your regular time, then I think that's probably okay.
Yeah, that's the thing about cognitive behavioral therapy training is that it is truly individualized. It's not everything works for everybody. but yet there are things that you can do to prepare yourself for sleep, to get in, to kind of reduce the worry and the panic that comes with trying to go to sleep at nighttime. I mean, there's some situations where they say, okay, if you're in bed and it's been 20 minutes and you're not asleep,
Get up.
And go do something else and come back. So it's
not something strenuous or
you're right.
mind
We want to
waking
keep the mind calm. Don't go get on the internet. Don't go do your emails, that type of thing. So
we should try to have a cognitive behavioral therapist for insomnia come on, because that would be a good conversation. So let's talk about circadian rhythm, because we've alluded to it already with a little bit of this cognitive behavioral therapy talk. But our circadian rhythm is basically, there's so many circadian rhythms. It's not only the 24-hour rhythm, but it's the monthly rhythm. It's the seasonal rhythm.
Right. And moving, you're not traveling from the East Coast to the West Coast changes your circadian rhythm. So just those hours of waking is really what you want to use to reset that rhythm. And it's the way that you make your body want to sleep. Essentially is what it boils down to.
And one of the great things to do is get morning light on your eyes within an hour of waking up, or if you wake up earlier than you'll have sunlight within an hour, then there are different types of devices that you can get to get some of that light on your eyes. But that is a really good trigger for your brain to know it is daytime. And then also
just minutes.
Yeah.
That's all it means. Yeah. You don't have to spend much time.
And then getting light on your eyes several times throughout the day if you can. A lot of us are stuck inside most of the time and don't get that little bit. So when the sun is shining, or even if it's not shining, even if it's cloudy, it's good. Get outside and get some of that light.
Yeah. And there's even talk and discussion about, okay, it's dark when I get up. What do I got to do? Oh, well, you can always spend a little bit of money on something that'd give you 10,000 lux of artificial light too. That may help but it's not as good as getting the real thing. I can just tell you that. Morning movement, that's also something that helps to control or emphasize that early morning cortisol spike that helps to regulate that system of, my cortisol is high. I'm going to get that movement done quickly. And then throughout the day, your cortisol level slowly drops. And that will help to kind of regulate that too for folks in the middle of the night. So
dim the lights in the evening, avoid blue light. They've got blue blocker glasses that you could wear if you really can't not use your computer. A lot of cell phones have where you can change it to night mode where it's not as much blue light.
I really noticed that too, because I've got readers that they're blue blockers and it really does make a difference. It makes a difference in my mood of what I'm reading. So during the day, if I'm got these blue blocker readers on, it's like, wow, it kind of sets the tone for me actually during the day even. So I know they work at night too. So
stopping caffeine earlier in the day, that's another thing that, some people say that is important, and some people kind of don't maybe think that.
Some people enjoy the taste of coffee, and I use decaf, even though it still has caffeine. It just, at least it's a minimal amount.
Yes.
But yes, try to discontinue that caffeine, noon, 2 at the latest. You got to give yourself a chance to try to go to sleep and become unwired when it comes time to go to bed at night.
And then my biggest thing, I think, is eating, and how, if you are having your biggest meal at nighttime, that can be hard. That can be really hard. And especially if you're having that meal, within 2 hours of bedtime, even worse. I mean, then you get into reflux and all of that.
Those heavy late night meals. A lot of people go out to eat late, so it just doesn't set you up for a good night's sleep. And then of course you're going out to eat, and sometimes you're going to have a wine or alcohol. So that just adds insult to injury.
And I will say alcohol tends to not only, we hear a lot of alcohol obviously disrupting sleep, but also causing night hot flashes, or, sweating during the night.
And it's one of those things that you can choose if you want to sleep or you don't want to sleep well. It's either alcohol and don't sleep well, or you're going to sleep without alcohol. So
Yeah.
it certainly plays a part.
We talked a little bit already about exercising in the morning helps to get that cortisol up higher so that you have a longer way to fall during the day. But if you're working out at night, just be mindful of how that is running into your sleep, because we know real life is you have to do these things when time allows.
Right.
And sometimes your schedule is such that you can only work out in the evening. And we would never say don't, but
Right.
just work with it.
Just be mindful about that. And then, of course, try to, the bedroom, try to make it nice and cool and, of course, dark. If that means better curtains, fine. Sometimes it's even the clock on the side of the bed is too much light in the room. So a nice, dark, cool room will help also.
So now we'll address something called non-sleep deep rest. This is similar to a yoga nidra, which is a mindfulness practice. This is when you take time out of your day, could be midday, could be early afternoon, to just relax. And this is really training that parasympathetic nervous system.
You're setting that parasympathetic nervous system. It's kind of a trade-off for a nap.
Yes. And we're actually going to be offering that here at Revelation Community Space once a week. And who knows, maybe more. But it's just a short 10 to 20 minutes of relaxation and kind of getting into your body and resetting.
Yeah, it's
the
great
nervous
when
system.
you're wired and overstimulated. So it really helps to reset that. And you'll often probably also see HRV rates improve. Those trends will improve with time with doing that too.
Okay, so we kind of touched on a lot of this, but I want to just bring it back together with a practical kind of sleep repair plan that you could start tonight if you wanted to.
And some things, it's like, okay, I can only do one thing. Well, then do one thing, do one thing, try to do that for a while and see what consistency does for you to help improve your quality of your sleep. So, but try to pick, I don't know, the kind of the best thing you can look at is try to pick a waking time, a waking time and a sleeping time, to kind of, you do your best with that. Obviously some individuals that have troubles because of their hours at work. So, but that's one way to help improve things that you can do.
Yeah. And then another thing is just experiment with giving up alcohol for a week and seeing how that changes your sleep.
Yeah. Yeah. And then, try to practice your wind down routine. Try to limit those screens, try to get the room a little darker, a little cooler, let the body know, okay, things are winding down and it's time for me to start settling in. And that may also help to improve. And don't try to power through. It's like, okay, as soon as this program's over, I'm gonna, I'll get up off the couch from taking my nap and then I'll go to bed. No, you're tired. If you're sleeping, go to bed, because you're interrupting your sleep by taking a nap in the chair or on the couch.
And I would say if your symptoms are suggestive of sleep apnea, really look to get that sleep study. There are so many options now. I know a lot of people are scared off by the idea of CPAP and having to wear a machine. And it's better to know if you have sleep apnea, because there are a lot of different things that you can do to kind of help improve that.
Mm-hmm. Yeah, and that reminds me, one thing that we didn't actually touch on is called Inspire for sleep apnea. It's kind of more of a neurological stimulator, if you will, for the tongue to help stimulate that tongue to bring it up out of the airway. And that's something that's done from it's not an auto PAP, a CPAP, or an oral appliance. So it is a surgical implantable device, and everyone does need to meet indications for it. So there's an extensive consultation that occurs with that.
And if insomnia is persistent, seek out some help with the cognitive behavioral therapy. And if you are a cognitive behavioral therapist, or you know of a good one in the Kansas City area or anywhere, please let us know, because we'd love to have a more in-depth conversation and have someone to refer to.
Yeah, some of those can be individualized, but they can also be group settings. So and even online, I've seen that too. So, but they're, good cognitive behavioral therapists are not easy to get into because they are busy. So
that kind of wraps up the
yeah.
talk on sleep.
So it just let everybody know how foundational sleep is, for recovery, repair, our hormones, and it's just generalized metabolic health. It's something that a lot of people, I would imagine the majority of the people experience difficulties and problems with it and find ways to get through it. So.
All right. Well, have a healthy day and sleep well.